And a new type of mammogram uses 3D technology, and it may help doctors more accurately screen for breast cancer. A new study finds 3D mammograms increase detection rates, and it reduces the chance of so-called false positives. The method was first approved by the FDA in 2011. Dr. Leanne Philpotts is chief of breast imaging at Yale University Medical Center. It was one of the first hospitals to use 3D. Good morning.
Good morning.
So we all know what 3D means, but explain how this type of mammography works.
So this mammography takes a series of low-dose images as it's scanning over an arc in the breast rather than just a straight image. And what this allows us to do is it gives us a lot of information that when we look at the images on our reading stations, we can scroll through and look at the breast in very thin slices. So rather than just getting a flat two-dimensional image, we can look slice by slice, and this helps us see through the tissue a lot better. We can find things that maybe we wouldn't have seen otherwise, and it can also help us in reducing a lot of the false positives from mammography, from 2D mammography.
What are some of the downsides?
So the downsides really is it's a little bit more radiation because at the present, it's what FDA approved is to be used in conjunction with two-dimensional mammography. So we do the combination of the 2D and the 3D. So that is increasing the radiation. However, it's very similar to the amount of radiation that people received when they had film mammography, which is just in the not too distant past. So the radiation dose is a little bit more. This is probably something that will be resolved in the near future as there is development of reconstructed two-dimensional mammography, so that we might be able to just do the 3D alone.
Bottom line is early detection, isn't it?
Absolutely. We're finding cancers that we would not have found otherwise, that are hiding in, particularly where there's dense tissue. It's areas that are hard to see through.
But it's important to point out, this is not yet covered by insurance. Why not?
That's true.
Because it's more expensive?
You know, I think we need to be able to have more literature on this, and there's certainly, you know, there is a lot of interest right now, and the papers, like the study that just came out yesterday, is showing very consistent and encouraging results.
So if you want to know where you can get a 3D mammogram, how can you find out who has this technology?
I think that you would really just have to call your local mammography facility right now to ask them if they have 3D. That's really the best way to find out.
Dr.
But I
Leanne
would
Philpotts,
encourage that.
Thank you so much. We appreciate it.